Once you've been told that someone is dead, my job is to go in and confirm that death, checking for life signs, listening to their chest. Normally after that, you might spend another 30 seconds just in there. I suppose maybe saying goodbye to them in the sort of weirdest way, just acknowledging they've gone, and then you pull the sheet over their head. It seems so incredible that, what you're seeing is the culmination of someone's whole life.
The only things that unify us is that we are all born and we will all die. Death is not abnormal, it is perfectly normal.
The best deaths, I guess, are those that are comfortable, peaceful. Even if someone is unconscious or confused, they may recognise a tone of voice, perfume, the touch of a hand.
She quietly read him his favourite poem just at the moment when he died.
His wife and his ex-wife spent the night sat in the hospital room drinking a bottle of wine with him. Just seemed a happy way to go.
This afternoon, the Foreign Secretary said the lockdown across the UK will remain in place for now. He said deaths are still rising and we haven't yet reached the peak of the virus. The government's chief scientific advisor...
Particularly in this area, the hospitals are full with COVID patients. A colleague described to me having seen someone in the morning who walked to the door who had died by that afternoon.
I would get called to look at, 1 or 2 deaths, whereas now it seems like there's often 10 people dying each night in the hospital.
I've had to look after a few patients. They were actively dying and they couldn't see the faces of anyone who was looking after them, including me. You sort of try and smile with your eyes, you try and show them some emotion or some human side, and make them feel like they're not alone at the end of their life. There was one Jamaican gentleman, we made the concession of allowing his elderly wife to come in and see him as he was dying. She had to wear a mask, she had to wear an apron, she had to wear gloves to see and touch her husband at the end of his life.
I got called to see a patient in the middle of the night who was very unwell. As I came in, his mobile phone was ringing. Before really doing anything else on that, we got moved on to focusing on his medical care and trying to optimise his oxygen. He passed away before the morning. I worried afterwards whether or not there's anything I could have done to make sure he could have spoken to his wife.
We've now had to make a blanket rule of family members not being able to come into the intensive care department. People aren't even able to come into the mortuary to be there with the body of their loved one because of infection control reasons. And I think there's going to be a huge amount of kind of emotional trauma that comes out of the back of COVID because people haven't been able to process the deaths of their loved one.
Some of the staff are struggling coming in and finding that their list of 10, 15 patients, there's only 2 alive, for example, after, literally one night. There's a real issue in palliative medicine with emotional burnout, but we're doing what we can to give people as comfortable and as normal a death as possible. But, this is a completely abnormal situation and we're learning as we're going along.
I do think in the UK we're quite resistant to talking about death. Potentially something that this awful pandemic will do is making people kind of much more aware of their own mortality and making it much more acceptable to be talking about.
When we are scared, the first instinct is to turn your face away from what is scaring you. And I think it's not a time to be doing that. I think it is a time to connect, converse, and just be clear about what's important. This too will end, and we will come through this, and we may have changed, and some of that will be for the worse, but some of that also must be for the good.